Lecture 7. Okay, now this is about the pathology of gallbladder. Okay, so in this lecture, inshallah, after the lecture, you guys can able to list the causes and types of gallstones and explain the pathogenesis of cholelithiasis. Cholelithiasis means what is it?
They need to tell me that you need to book the video.
1 meter.
The video. You want me to record the lecture?
I'm recording this lecture. Please sit down. What's your problem? What do you want?
The leader told me that to give you this so you can put the lecture here. The video.
Yeah, you want the video now?
Yeah.
We already.
Just give it to you.
Yeah, keep it here.
Put it
So it's a pathology of gallbladder. So inshallah, after this lecture, you can able to list the cause and types of gallstones and explain the pathogenesis of cholelithiasis. Cholelithiasis means gallstones. Okay, so you can able to explain the pathogenesis of cholelithiasis, and you can also explain the pathogenesis and morphology of cholecystitis. Cholecystitis means inflammation of the gallbladder. So this obstructive jaundice about cholestasis we discussed already in the pathology of liver. So here you will be able to differentiate between the intrahepatic and extrahepatic cholangiocarcinoma. It's very important to differentiate the cholangiocarcinoma. This is a cancer coming from the bile ducts. Okay, so the bile ducts are located in the inside the liver as well as outside the liver. So the cancer can come inside the liver as well as outside the liver. So it is called intrahepatic cholangiocarcinoma if it comes inside the liver. It is extrahepatic cholangiocarcinoma if it comes outside the liver. So first let us discuss about the gallstones. There are two main types of gallstones. One is called cholesterol stones, which forms cholesterol crystal monohydrate. Okay, there will be a chemical component name is called cholesterol monohydrate, and pigment stones, it is called bilirubin calcium stones. Okay, it's a component of bilirubin is there, so it forms the pigment along with the calcium. Okay, so normally when there is excess cholesterol, it is removed by our body by formation of bile salts. Okay, from the cholesterol they form the bile salts and the excess cholesterol is removed. Excess cholesterol is removed, and if the cholesterol concentration is exceed the solubilizing capacity of the bile, which means the bile is less, cholesterol is more. Understand? So if it is exceeding the dissolving capacity of the bile, then the cholesterol stone formations happens. Okay, so that is called supersaturation. This is called supersaturation, and the crystallization happens. So another reason is hypomobility of the gallbladder. Mobility of the gallbladder is affected. Mobility of the gallbladder is affected, so the content stays in the gallbladder for longer duration. The content stays in the gallbladder for longer duration. It is called stasis. And then when for example, now the cholesterol is more, the bile is less, then supersaturation happens, the mobility is affected, then the content is staying there for longer period, then they all join together, then they form the stone. That is called nucleation. All the substance come close together and they all join together. That is called nucleation. Then the mucus will go for hypersecretion. The gallbladder secretes more mucus, then it all join together and they form the stone. They all join together and form the stones. This is up to this is the pathogenesis of cholesterol stone formation. Actually, formation of pigment stone is totally different. Actually, it is because of the unconjugated bilirubin. Because of the unconjugated bilirubin, increase in the unconjugated bilirubin especially happens in the hemolytic anemia and infection. So what is the common cause for pigment stones? It is hemolytic anemia and the infections that are the most commonest cause for pigment stones. Pigment stones means bilirubin plus calcium, bilirubin plus calcium. Okay. So you all should know there are two types of stones. One is cholesterol stones, other one is pigment stones. Cholesterol stone is nothing but it's a cholesterol monohydrate crystals. Cholesterol monohydrate crystals, and pigment stone is due to bilirubin, that is excess bilirubin, and it joins with the calcium and they form the stones. Now pure cholesterol stones are pale yellow in color, and there will be more calcium carbonate phosphates, bilirubin may be joined together and give a white to black discoloration. Now actually pure cholesterol stones are very rare. Actually it's a mixed stones. They have some color as well as the cholesterol component. Both will be there. So the cholesterol stones are radiolucent. What do you mean by radiolucent? If you take a X-ray, you will not find the stone. Okay, it is radiolucent. It is not visible in X-ray. Okay, so calcium, if there is calcium carbonate, if the calcium is there, then it becomes radio opaque. Then it becomes radio opaque. It will be visible in the X-ray. So pigment stones are radio opaque. Most of the pigment stones are radio opaque. Okay, so if you ask me whether the cholesterol stones or pigment stones are visible in the X-ray, the pigment stones are more visible in the X-ray than the cholesterol stones. So normally they will be asymptomatic. If symptomatic, the pain comes very cruciating pain, and it will be in the right upper quadrant or in the epigastric region. Epigastric region. The pain will be referred to the epigastric region, or it will be in the right upper quadrant. Okay, just near to the liver. And the pain, if it is there, it will produce severe colicky kind of pain. The patient cannot tolerate the pain. Okay, wherever the stone comes, if the pain comes, it will be very severe. If, even in the ureter, even in the uteric pain. So these are all the areas where we can get the stones. It will be very severe. So this is the mixed stone, and you are seeing pigmented stone here. Okay, so these are the color of the stones. Now coming to the cholecystitis. Cholecystitis means what? Inflammation of the gallbladder. It may be acute or chronic, or acute superimposed on the chronic. There is a chronic inflammation, but all of a sudden it will become acute. All of a sudden it will become acute. That is called acute superimposed on chronic. So the two types of cholecystitis very commonly seen, that is acute cholecystitis and chronic cholecystitis. And in acute cholecystitis there are two types. One is due to calculus. It is called acute calculus cholecystitis. It is not due to stone. It is called acute acalculus cholecystitis. Commonly due to infections. Commonly due to infections. So morphology, the whole gallbladder will become pus. Okay, it is called empyema. So the whole bladder will be inside the gallbladder full of pus will be there, and gallbladder can go for gangrenous necrosis. Can go for gangrenous necrosis. Okay, so what are the most important factors you should remember in acute cholecystitis is it can lead to bacterial superinfection, and it can lead to sepsis. It can lead to septicemia. And gallbladder can perforate, and the local abscess formation, the abscess can be sent to the peritoneum, and gallbladder ruptures and it produces severe peritonitis. It will produce severe peritonitis. And biliary enteric fistula, that is the gallbladder and the intestines can form a fistula, and the bile will be drained into the other organs. Bile will be drained into the other organs, and entry of bacteria into the biliary tree will happen. So that will produce severe complication, that is called ileus. That is called ileus. That is gallstone induced intestinal obstruction. Gallstone induced intestinal obstruction. And if there is any pre-existing medical illness, that will aggravate. For example, if the person is having cardiac disease, that will aggravate the cardiac disease. So we don't know why it is happening, but if the person is having cardiac illness and if they develop inflammation of the gallbladder, the cardiac illness will become severe. The cardiac illness will become severe. So likewise, if they have lung disease, the lung disease will become severe. Okay, so these are the things we identified on based on clinical studies. Now coming to the carcinoma of gallbladder. It is most commonly seen in the women. The most commonest tumor is adenocarcinoma, and mostly it will be exophytic. Sometimes it will be infiltrative. Infiltrative means it goes into the wall of the gallbladder. And usually it is identified in the advanced stage. Because usually it will produce obstructive jaundice. When you investigate the obstructive jaundice, you will be identifying this. Tumor. Now coming to the most important one, it is cholangiocarcinomas or adenocarcinomas arise from the cholangiocytes these are the cells line the biliary ducts. What are the cell name? Cholangiocytes. Okay, the tumor comes from the cholangiocytes. It is called cholangiocarcinoma. If it arises from the hilum, of the liver, it is called Klatskin tumor. So it's just a name, so if it is seen in the hilum, it is called Klatskin tumor. Okay, now intrahepatic carcinoma and extrahepatic cholangiocarcinoma, there are clinically they produce different symptoms. Okay, and it is intrahepatic. What it means? It is inside the liver. Okay, this tumor, malignant tumor, comes inside the liver. It will produce hepatic mass. It will produce mass in the liver, and they will increase the serum level of alkaline phosphatase as well as aminotransferase, AST, ALT, and alkaline phosphatase. All will be elevated. And here, if the bilirubin is elevated, most probably it will be of unconjugated. Because it will damage the liver cells. So that's why AST, ALT is elevated. Along with alkaline phosphatase, and if the bilirubin is elevated, it will be of unconjugated. Now coming to the extrahepatic cholangiocarcinoma, it comes from the extrahepatic bile duct, and they produce jaundice and acolic stools. It is a pale stool because they produce severe obstruction. Pale stools and nausea, vomiting, and they produce biliary obstruction. If you see here there will be increased conjugated bilirubin level. Here AST, ALT will be normal. Because it is happening in the extrahepatic. If it happens in the intrahepatic, liver enzymes will be elevated. So this you should able to differentiate between these two tumor based on lab investigation. So once again, I just tell you the most important feature in this slide. So there are malignant tumors arise from the cholangiocytes. The cholangiocytes are the cells which lines the bile duct. Okay, they are the lining cells of the bile duct. What is the cell name? Cholangiocytes. So you know the bile duct is inside the liver as well as outside the liver. Inside the liver it is called intrahepatic bile duct, biliary tree, and extrahepatic. So intrahepatic, if the tumor comes, it is like produce a mass effect in the liver. So they will destroy the liver cells and liver enzymes will be elevated. Okay, hepatic injury enzymes like AST, ALT, and bile duct enzyme like bile canaliculi enzyme, alkaline phosphatase, all will be elevated, and they also will elevate the unconjugated bilirubin. When if the same tumor comes extrahepatic, the scenario is different. They produce obstruction the patient will have a acholic stool, which means a pale stool, and another thing is they produce conjugated bilirubinemia. They produce conjugated bilirubinemia. The liver enzymes will be normal. Okay. So these are the features of cholangiocarcinoma, extrahepatic and intrahepatic. Why I am mentioning this is we can differentiate this tumor on the basis of lab investigations and the clinical features. Okay, this I think this ends the slide. The pathology of gallbladder. So you can refer to these pages. This will help you to get more details.